Hello, it's Dr. Sarah Moore here. Today I'm sharing with you my 5 tips for thriving as a new mum in the postpartum period. So in this video, I'm going to discuss with you the importance of a daily practice during the postpartum period. I'll ask you to consider the new skills that you'll be learning. I'll discuss what's covered during your postpartum check with your doctor. I'll explain the various contraceptive options. And I will encourage you to build your village of support. So first of all, a daily practice. The moments, hours, and days and weeks after your birth are likely to take you on a roller coaster ride like no other that you've experienced before. Like labour and birth, this period is uncertain and unpredictable. You will have endured labour and birthed a new life. And now you'll be entering a new world where priorities have changed and you are learning new skills and a new way of life. You'll be called to be present in the moment again and again and again. This is where your mindfulness practice, your self-compassion and your gratitude can be so incredibly valuable as you encounter numerous firsts and wonder why no one told you about any of them. So in terms of new skills, you will be learning to breastfeed, to recognise your baby's cries, to settle your baby to sleep, to change their nappy, to negotiate how to relate to your partner, especially intimately, to manage sleep deprivation, to re-establish your daily routine. All of this is completely normal and at times completely overwhelming. When you go to visit your GP for your postpartum visit, I would encourage you to make a long appointment so that you've got plenty of time to discuss your physical and emotional well-being and also check your baby. I always ask about breasts and breastfeeding when I see women. I check the perineum or the Caesar wound. I'll also ask about bladder and bowel function and also check in on how you're feeling from a mood perspective and how you're sleeping. Further to this, I discuss your baby's health and development and conduct a complete head-to-toe check and weigh your baby. I also will discuss vaccinations, and these can be performed at the 6-week check if you choose. It's likely that you're going to have questions and even some concerns about how you and your baby are coping, so I'll always make time to address these here. In terms of contraception, I will discuss all the options, which include barrier protection, progesterone-only pill, Depo-Provera injection, the Implanon implant, and the Mirena IUD and the copper IUD. Information on each of these is available on the Sexual Health Quarters website, and I also have pamphlets that I can provide to women. In terms of building your village, one message I always communicate very clearly to new mums is that you are not supposed to do this on your own. The old cliche, it takes a village to raise a child, is a cliche because it's very true. I'd really like to see the cliche extended to include it takes a village to raise a child and support its mother. This is a time when you'll be challenged and you will need to ask for help from your partner, from your family, from your friends, from your health professionals and from community members. You will need to feel comfortable requesting frozen meals for the freezer, asking guests to do the washing up after they've popped in for a cuppa, and leaving the bathroom for someone else to clean. Please ask for help. Please speak up if you are struggling. There are people who want to help you, and it will bring them much pleasure and joy. And it will also make your job so much easier and enjoyable. Postnatal anxiety and depression affect 1 in 7 women. And I believe much of this is because women have very high expectations of themselves as new mums, and they believe that they need to do it on their own. You don't. You can't. In many ways, the postpartum period is my favourite part of the pregnancy journey, not only because I'm privileged enough to observe the unconditional love that instantly bonds a mother to her new baby, but mainly because I get to witness the courage that new mothers demonstrate as they take on one of the most challenging and yet empowering roles of their lives. There is so much more I could share. However, in the interest of time, I'm not going to, but I do hope that my message is very loud and clear. Take care of yourself so that you can take care of your baby. You'll need help. Please ask for it. Then take the front seat and enjoy the ride. In summary, my 5 tips for thriving as a new mum: maintain a daily practice during the postpartum period. Be patient with yourself as you learn the many new skills required of a new mum. Make a long appointment with your doctor around 4 to 6 weeks to ensure that you have time for a complete assessment of yourself and your baby. Consider your contraceptive options and build your village of support, remembering it's okay to ask for help. Please visit my website, drsarahmoore.com, and if you like, subscribe to my blog, This Doctor's Life, and you'll receive more information like this every month. Thanks for watching.